Hello everyone, welcome to All About Physiotherapy. Today our guest is the movement doctor, Dr. CJ.DePalma, DPT, who believes in educate and power. He thinks very differently, and his uh, all his work is evidence based. So hello Dr. CJ.
What's going on? Good morning or good afternoon for you.
Good evening over here and good morning to you. Thanks for
Yep,
taking time early in the morning for us.
sure. Of course. There we go. Cool.
Yeah,
All right.
and what about the COVID-19 thing which is going in the world? Are your people safe?
Yeah, everyone's fine here. I'm in a Pensacola isn't a big metropolitan, so population's a little bit low here, so it's fine. Most of what I do was already online, so I'm relatively not overwhelmingly affected. But I do own a clinic that's not seeing patients right now. But we're fine. My family's fine. Everyone is self-quarantined fine. The country should start opening up soon, so we'll see. The first state is actually reducing some of the quarantine mandates today, so we'll see how it goes in the next couple of weeks. It's going to be interesting.
Yeah, we hope that everyone
Oh
stays
no!
safe.
Yeah,
So should I start with the question?
sure.
Yeah. So my first question to you is, how did you develop interest in the field of physical therapy?
Um, So I was in strength and conditioning performance for a long time, and I was in college and getting ready to take the route to go to graduate school and post grad to be a strength coach for football or baseball, whatever. And to be honest, I realized there was a very, very minimal amount of financial gain to be made. And I'm definitely not in this for the money, but the amount of money when I was coming through undergrad that strength coaches were making here was less than I was making as a personal trainer at a local gym. And I'm a family guy, and I really wanted to make sure I could provide. And so I was like, well, how can I do something similar, but, still be able to provide for my family? Physical therapy was something, I've always enjoyed, and understanding the human body is something that I've prioritized as a life goal. And so I was introduced to the right people, and it just kind of fell that way to go to PT school. And then I ended up being a strength coach anyways, just for CrossFit instead of football and baseball. So it worked out pretty well.
Okay. So sir, we have found some lines from your Instagram page, and we will ask you to justify them.
All
Yeah.
right.
So justify this line of yours. Lifting weight is not bad for your child.
It's not bad for your what?
Your child.
No, it's not. Not a chance. So am I justifying this? Am I defending myself? Is that what's happening?
Yeah, you just have to justify this line. Why have you said this?
Okay. So there's been a big myth. Most of my page is basically driven on like debunking myths, but the
Yeah.
myth of that lifting weights stunts growth has never been proven. There's not a lot of efficacy there. It sounds really cool. People think that children, their bones are more brittle, and they are technically, because they're spongy and they're not as compact, etc. Growth plates are still open. But none of that is affected by load, right? If anything, loading bones early will set us up for more success later in life. Now, I'm not saying that they should go into true strength training protocols, right? But lifting weights to general tolerance and is very safe. There's nothing bad about it. I mean, there's obviously we can be a martyr, right? And like push our kids too far, but you can do that with anything, running, swimming, whatever, any sports selection, right? So it's within reason, but there's nothing dangerous inherently about lifting weights as an adolescent.
So genetics play a very important role in this. Your
Say that one
genetic,
more time.
Your genetics play a very important role in this, right?
Um, as far as if it's safe or not, or I don't know. I don't know how genetics would play a role. I mean, obviously, some people are more predisposed to be more muscular or fit and
Yes.
have a different genetic makeup. But no, I don't think your genetic code defines if lifting weights is safe or not. Now, maybe as far as intensity, yes, for sure. Some people are going to be able to manage, and they're going to look like Arnold Schwarzenegger more naturally than say me, who has to work really hard to not like be very skinny, right, and very thin. So yes, as far as aesthetically and how you respond to weight training, genetics play a role for sure. But I think it's more so of the statement is it safe or not, and it's very safe.
It is. So, sir, tell us something about your daily routine.
Well, this is my garage. So this is where I work and work out. This is my doggy, my puppy dog. That's Duke.
Yeah, he's
He's
cute.
my buddy.
Oh,
He's my buddy. So we hang out all day. My normal routine, I usually get up around 6 or 7. I used to get up a lot earlier, like 4:30 or 5, and then I decided that was way too early. And um, I get up and I have coffee. I fast every day, intermittent fasting. So I do a 16/8. So I'm 16 hours fasted just about every day. And I I train in the middle of the day. I usually do computer work in the morning. I see patients sometime in the morning too. I treat 2 days a week. I see patients in person 2 days a week, and then everything else is remote online. So my day isn't very consistent. I'm actually in a mentorship group talking about batching time and being more effective, but I'm just not very good at having like the same structure every day. So my day is kind of varied, but I've kind of set it up like that. Some nights I'll work till 2 or 3 in the morning. Other days I won't even open my computer. So, but I definitely put a ton of work in. You know, my average work week is probably 50 to 60 hours, just not your traditional time frames.
right, right. So, sir, one of your line from your Instagram page we have found that a certification does not make you a good coach. Why is that so?
You know, it's funny. That's a double-edged sword, right? And just because you don't have one doesn't mean you don't know anything either, right? But you know, there's a lot of PTs, chiropractors, DOs, osteopaths that have all the education in the world, and I think you know, they don't know, they don't know shit from shit, and it's just, it doesn't mean anything. But at the same time, just because you don't have one doesn't mean you can't understand it very well, right? It's definitely like this double-edged sword of it doesn't mean everything, but it definitely does help. I'm not saying that having a degree or a certification doesn't help, but just because you have it doesn't mean that you're there, right? It's all about, to me, it's all about how well you're invested in the evidence, right? And that's of everything, right? Which doesn't justify your education whatsoever. If you understand the evidence of whatever you're trying to do, doesn't matter how many degrees you don't have or have, you can be you can be a PhD, but if you're practicing antiquated evidence or anecdotal reasoning, then that's wrong. I mean, that's just not what we should be doing. This is a medical profession. Medicine is research driven. It's not anecdotal driven. So, and that's where that comes from. So
Okay. So, sir, what is the definition of physical therapy according to you?
what is the definition of physical therapy?
Yeah, according to you.
Oh God, that's such a terrible. Ugh. Um, Give me a second. I hate that question. I think so. To me, it's uh, being able to provide guidance, coaching, and direction for those that are struggling with pain and injury. I mean, I think it's, I don't think it has anything to do with what modality we're using or what intervention. It's just guidance. Whether that's, if it means manual, fine. I obviously, you see my page. I don't use it. I don't promote it. I have my reserves about it. But if that's your avenue, that's fine. The current definition of physical therapy has like massage, stem, and ice in the definition, which is mind blowing to me that like that's what is defined as it. And society has given us a certain persona that they expect us to follow. And it's just, even the people that are antiquated and kind of practicing old styles aren't practicing what the medical definition of physical therapy is, right? But I think it's rehabbing and helping, assisting, coaching, guiding those through pain and injury, right, to get back to a healthy functional status. And that's like a very broad. So functional status, obviously the majority of people I work with, and I see them well past what would be considered physical therapy timelines into performance timelines, but I have that secondary knowledge, allows me to expand, I guess, my treatment range from injured to performance and all the way through. So I think plenty of physical therapists can be good performance teachers. And I think a lot of performance coaches could be great physical therapists as well. It's all in the same scale, right? It's just a range. Performance training is no different than physical therapy, except someone has pain, right? And so we address the pain, but we address it very similarly. So I think it's just improving function and improving overall ability of daily living.
Okay. So, sir, in 2019, you were being awarded as one of the best physical therapists. Tell us something about that. How was that feeling?
So that was best. That's best in the Bay. Totally different. That's my little town, but it's cool. It's just me. It's small. I'm in a city with the Andrews Institute, which is a world-renowned orthopedic group. And their physical therapists are here. We have huge hospital systems here with a ton of physical therapists. There's a lot of Medicare and TRICARE, which is military insurance. So there's a ton of PTs here and there's a lot of injured people. So it was cool, right? It is kind of like a popularity thing, and I wouldn't say it makes me the best by any means whatsoever. I never look at it like that, but it's nice. It's just me. I'm a small practice. I'm the only cash pay practice anywhere near here. It's a very old school city, very conservative, and a little behind the times. So it was nice for sure. But I definitely wouldn't say it makes me the best by any means, but it's nice to be recognized with these big hospital systems.
And there was the contribution of your team also in that, right? As you have mentioned.
Yeah. My marketing team. Yeah. Those are my buddies. Yeah. Those are good friends of mine. They're awesome. Social media. I have a social media person and then a paid marketing person. She does a lot of my website design and copywriting and things like that.
So, sir, one more of your line is here. Surgery will not fix your pain.
Yeah. So a lot of time, surgery purely for pain doesn't have a lot of good numbers behind it, right? Surgery for function, 100%. And I'm not saying it won't, right? That's like, it's when you have chronic pain, most of the time it's very little to do with structure, right? The evidence really shows us this, that it's multifactorial. And what cures your pain is the theatrical effect of surgery, right?
Right.
If, so you have a meniscal tear, you've had a meniscal tear for 30 years, whatever. And we know that plenty of people they're asymptomatic with meniscal tears. So why is yours different? It could be some structural differences, but you have surgery and then you feel better, right? Your function improves. So your demeanor improves, your hormones are improved, your outlook on life is better. So your function is improving, right? If it's limiting your function, which most of the time it doesn't really, right? But the theatrical effect in your expectations and beliefs of going through the process of surgery, we're learning that probably has a bigger role on how you feel afterwards than the structural changes that have been made within surgery, which is fine. That's totally okay. If you have knee pain for years and nothing helps, and you need surgery and you come out and you feel 100% better, I'm not saying it's bad, right? Just understanding the facts, right? It's the same thing when I talk about stretching. There's nothing wrong with stretching, right? It's just, what is it doing? Is it doing what we thought? Probably not, right? Is it changing as much as we thought it was, or is it needed as much as we thought, right? Do we need surgery to get out of pain? Most of the time it's no. So
sir, why do you think that IT band is not tight?
because it's not.
Have you been through any evidence studies for that?
Yeah, so there's some studies out there where we have our overs test and we drop the leg, right? Whatever. And I don't know. I feel like I was always positive for it. And I've never, when I start running a ton, if I increase my running, I'll get some lateral knee pain for sure, right? I'm not saying there's no IT band pain, but as far as tight, the numbers just don't justify it. It's really thick. It's a sheath. It's just like this wire band, that runs. I was in a rotation in PT school, and they did a ton of ART, so active release technique. And we would walk out of there and people would just be black and blue. They'd be the color of your shirt with how much Graston and thumb pressure we put on them. I'd have tendonitis in my hand. My hands were hurting. We'd be digging at them all day and it just wouldn't loosen up, and just, what's going on? And the evidence just shows that it doesn't get tight, right? There's a study out there that compared cadavers, and they cut the IT band and their overs test didn't change. Some people just won't drop, which is fine, right? But it's just not a good, you don't need. Go ahead.
If it does not get tight, so what is the use of stretching it? So it cannot be stretched also, right?
Correct.
Means there is no use of stretching IT band.
Probably not. No. What are you stretching, right? You could be stretching some like lateral hip, glute med, TFL, maybe if it's irritated. We know stretching helps irritation, right? Like there's nothing to say that everything helps sensory modification, right? So I feel really stiff today, I'm going to stretch. Okay, well, yeah, you'll feel better, but like, what did you do, right? If you would have walked, you probably would have had the same result, right? A lot of IT band irritation is usually due to increased activity, right? Maybe some really funny biomechanics, but probably not unless you just started, again, a brand new, a new training stimulus, right? So more running, right? Or different style of running, or maybe new shoes or something like that, right? Like your body's trying to figure out how to adapt to that. So, but usually most people, they don't hurt from the first 20 steps of running. It's later into their bout, right? Their training session, a mile, 2 miles, like, oh man, my IT hurts. Well, it didn't all of a sudden get tight as you got more warm, right? It got fatigued, so what do? We build the endurance and we build the tolerance of the hip muscles, which will then help, further down and help that knee pain, so, but no, you can't stretch the IT band. It's pointless.
Yeah, from when I used to tell people that IT band cannot be stretched, and I've got someone with whom I can relate to this.
Yeah. Oh yeah, everybody. Just how it is. But that's what we're taught in school. So, I mean, that's what, no one's a martyr about it. Like I don't think anyone that says that is malicious in what they think, right? They just don't know. It's what they were taught, right? We're conditioned as humans. We went to school, we paid a lot of money, right? Some people we paid a lot of money, way too much. But most countries don't pay that much money, but way too much money. So because of our investment and our belief in this, what we've invested in, we believe and we're conditioned to accept that as truth, right? And I thought it. I mean, I used to fucking dig at some IT bands. I mean, just make people blue and purple, red in the face, tears coming down. I'm like, I'm gonna fix it, and it just wouldn't do shit. So, it is what it is. But you learn, right? And you be okay with changing your patterns. Like if a study came out and was like, we can stretch it, we'd go through it and give me a meta-analysis of it and maybe some systematic reviews of more studies. I'd be all for it. I would be so excited if we could, change the viewpoint of how these manual interventions affect people. And, but it's just not there, right? Exercise is still shown to be just as affected. And, our self-reliance is the most important thing. And I believe with a lot of these passive interventions, we create a lot of reliant patterns instead of self-reliant patterns. So.
Okay. So, sir, tell us some advantages of CrossFit training over any other training.
Say that one more time.
Advantages of CrossFit training over any other exercises.
Why CrossFit over other exercises?
Yeah.
Oh, because it's awesome. Duh. No. So for me personally, or just for someone in general?
No, you personally. I just want your answer.
Yeah. So I was in bodybuilding for a long time, and I did like the aesthetic thing, and I played baseball in college, and I hated CrossFit. I was a big advocate against it. When I was strength and conditioning, and my buddy started doing it. My best friend, he was the best man at my wedding, and he was like, you should try this. And I'm like, no, I'm not doing this. It's stupid, blah, 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 blah. And I tried it, and I'm super competitive, and I've always loved fitness, and I don't know if there's a better true expression of overall fitness on the planet from a universal standpoint, addressing all modalities in all energy systems of fitness. And I just really like it. And I'm not terrible at it, which is nice, right? You like to do things you're kind of good at. So I enjoy it. I enjoy coaching it. I enjoy partaking in it. It's difficult. It's hard. And, it's a lot of fun. And I fell in love with it before PT school, and I derived my whole life around it.
Okay. So one personal question to you is that who has always been your inspiration and why?
I don't know. I've never always been my inspiration. As far as like someone I idol to like be like, I probably wouldn't say just anyone. I have this like ideal of like what I want to be, and it's kind of driven me of, being a successful businessman and a successful husband and father, and that kind of drives me. I let like business comes very natural to me. My dad was a salesman, and I can sell anything to anyone. I can talk my way out of anything. But what didn't come very natural was being a very good family man. And so I work really hard to make sure that that's always my number one goal with growing the business and growing personally. So I always let that, is like there's a very inverse relationship to successful businessmen and really good family men, right? Very rarely do you see a super successful business person who's an excellent father and husband and very committed to their family, right? So I've always been like, I know I can grow this easily, right? And I want to make sure this stays with it. So that's always been my goal. So I would say that's kind of like where the idol comes from, of like that envisionment of business success, family success.
Okay. So, sir, when did you start this garage of yours?
So we bought the house 2 years ago.
So this is near to your house only?
This is, yeah. So this is just here. I mean, I think I had like maybe a couple dumbbells or something, but we had the garage, and my wife was like, I want to be able to put the cars in here. And I'm like, we don't have to worry about that. We just make this a garage gym. And we can still fit both the cars in here. But I started right when I got here. It took me about a year to complete. I did it all through Facebook. Nothing was bought new. So it was cool.
During the quarantine period, you can work out over here.
Oh yeah. Yeah, every day. Yeah, I don't have to leave. And that's the goal, right? That was like one of the reasonings. You know, I treat people here in the garage. I see patients here. But you know, when the time comes when we have kids and we're really busy and I need to work out at 4 a.m, I live like 2 minutes from my office though, the gym, the CrossFit gym. So it's not that big of a deal, but it's very convenient. I can just walk out here and start lifting and at any time. So it's nice.
Okay. So sir, my last question to you is, any advice that you want to give the physical therapist around the world to be successful in their life?
Yeah. No, there's my puppy. Watch out. Go. Sit. Thank you. I would say, you know, don't let school be the only thing you learn. Always be driving to grow with your didactic knowledge and your physical therapy knowledge. And for everybody, you know, at least in the States, the face of physical therapy is changing, and, you know, business is really important. Sales is really important. You know, some people are like, oh, it's medicine, we shouldn't have to sell it. And it's, you know, but we know that this, you know, the psychological implications of someone buying into whatever is coming out of your mouth is huge to their outcomes, right? We have great evidence to show if they're bought in, they're going to get better, regardless of what you're selling them. You could sell them the perfect rehab plan, evidence-driven 100%, or I could sell them pixie dust, blow it in their face, and if they believe they were going to get better, they would get better, right? So being okay, learn some sales, learn some business, right? And you know, what do they call it? They call it the soft skills. Soft skills are what we don't learn in school, and I think that's the most important thing of our profession, is just being able to communicate with people, being able to express, being able to relate, right? And giving them an optimistic situation. So that's what creates the most success. You know, we all have our reserves on how we should treat, but nothing should change. You should use positive language. You shouldn't be fear-mongering. You shouldn't be telling them what's wrong, even because we don't really know, right? We're guessing, educated guesses, but, you know, so that communication and your soft skills with your patient is probably the most important thing. That's what's going to get you the best outcomes, not going and taking another 47 certifications on taping and manual and exercise. You know, your protocol will be fine. It's usually okay. It's probably good enough because people just get better. But if they're scared and they're worried and they're fearful, they're not going to get better. So being able to communicate is probably the number one thing I could suggest to any PT. You do that really well, you're going to see a lot of success.
Right. So nowadays people, they try to do dry needling and some soft tissue manipulations. Do you work on that?
No.
No. You are mostly based on exercises, manual therapy.
I mean, I will. So if someone comes in, so I don't see a lot of acute injury. So I'm okay not putting my hands on anybody. If I saw a lot more acute, right, like new, you know, like if someone comes in and they have a lot of cervical pain and they can't move, right, we'll put them on the table and we'll do a lot of passive stuff, right, because we're trying to reduce the guarding. But other than that, you know, like, I mean, I put, you know, if they come in and they're stuck and they can't bend over, right, I'll do, you know, as far as like manual soft tissue, no, but my hands are on people, right? So manual is a very loose term, right? Am I doing joint mobs? No, not at all. Very, very seldom. To some of my friends that I know what they're doing, and I know that they, you know, they just like, you know, they're, I don't know, you know, and the only time that I really do any type of hands-on is for cervical, right? Just because it's hard to create a lot of good low resistance training to the cervical region. So I'll put my hands on them and do a lot of like isometrics and passive rotations and stuff like that. But I'm not doing joint mobs. I'm not doing, grade fives, thrusts. I will to some friends, right, that, that want, like, hey, pop my back. It's like, okay, fine. But no, not ever, from like a symptom management standpoint, that's not what I do. I don't, I'm not here to, you're sore after training. You won't be sore in 48 hours. You don't need to come pay me money to work on you. That's a whole business. That's a huge part of physical therapy. I don't think it's physical therapy. I think it's massage. I don't think physical therapy is about improving in moving steps forward. That's just managing, and there's nothing ever changing with that. It's a great business model. And I've told everyone this, that every PT that says, I want to be in the CrossFit space. And I'm like, okay, you want to make a lot of money? You do this whole tune-up soft tissue thing, and you keep people training, because you will see them every 2 weeks or every month forever. But to me, you are just a glorified massage therapist at that point, right? But that's what people want to do. And some people will fight me on that and say no, and that's fine. But no, I mean, 98% of what I do is hands off and education and redirecting and mindfulness and really just painting a picture of like, you can manage this. Let me guide you in this direction.
Yes, and when I went through your Instagram page, I could relate so much, and I could think the way you think is very different from any other physical therapist. I've interviewed till now. I have interviewed some six great physical therapists from around the world. I have one more interview after this. But when I went through your page of Instagram, the amount of evidence-based studies you have is like another level. I just admire it a lot.
Good. Well, I'm glad. Thank you so much. It's I learned from a lot of other people, right? I'm not a pioneer or anything like that. I learned from people like Adam Meekins and Greg Lehman and Jared Hall and these guys who learned from bigger names, and Mosley and these pain neuroscientists, right? And it's all about that, right? And it really is. Pain is just so misunderstood, and there's so many misconceptions about it. So I just kind of directed towards that, and then the performance thing that's fun, right? It's a lot of good time. So.
Okay, sir. So my last question is: have you ever visited India?
No, I want to travel. No, I haven't. Tell me about it.
Yes, if you get time, anytime you can please come. India is a very good place to see.
Yeah. Have you been to the States?
What?
Have you ever been to the States, to America?
No, sir. I'll be doing my master's and then I'm planning to come there.
Awesome. Well, you hit me up. I'm in Florida. Welcome. More than welcome to come here.
And you are also, will welcome you with open arms anytime you come to India.
Awesome. Thank you so much, Doctor.
Okay, sir. Thanks a lot for your time. I hope it was a good interview.
Yeah, it was good.
Thanks for taking time early in the morning. It's a pleasure and an honor to interview you.
Cool. Thanks, guys. You have a good one.
Bye-bye. Take care.